Greetings to everybody and welcome to this lecture on Alzheimer's disease. September month is observed as Alzheimer's month, and we are soon reaching the September month, and 21st of September is observed as World Alzheimer's Day. So it's important that we learn more about it so that the disease can be diagnosed early, because if we diagnose the disease early, multi-component intervention is going to reverse it. So the slogan for the year is, it is never too early, never too late. So anybody who thinks who has some memory issues, they should come for testing and get treated if it is Alzheimer's or any related disorders, and if it is not, still they have to be put on a multi-component intervention. I bring greetings from the Department of Geriatric Medicine, Yenepoya University. So why is dementia important? You can see the picture of a senior citizen, the first one with a grandchild and enjoying the retired life, and the second one where he has developed dementia, early dementia, where he is trying to join an exercise group, and the third stage where he is just bound to a wheelchair. And this is what happened to my father, my mentor and my hero, who retired as a principal of a government college, and he was very active until the age of 75 when this Alzheimer's disease hit him very badly, and that is where we learnt a lot about how to care for a person with Alzheimer's disease. So the report says that nearly 75% of the people with dementia are living in the developing countries. And 20 years of research has shown that there are newer therapies, there are many drugs which help us in management of dementia, and multi-component therapy which includes exercise, yoga, art, music, dance, brain stimulation activity is really helping these elders with Alzheimer's disease or related disorders. Although we were using this as a part of prevention, now we know as therapy it has come out in a big way in a trial called as FINGER study, where multi-component intervention worldwide has shown that it is going to improve people's cognition or memory as well as other cognitive functions. So dementia is the price we have to pay as we live longer. It doesn't mean that as all of us will get dementia if we live to be 100. But you can see there in the graph that the prevalence of dementia rises with aging, and we can't do anything about aging. So when I talk about dementia and Alzheimer's disease, dementia is an umbrella term and Alzheimer's disease is one type of dementia. Today we don't call it as dementia because the thin line between memory impairment which can happen with aging and early dementia is very, very thin, because when we say dementia, it is a very bad diagnosis that we are going to give, and we are going to say that it is irreversible. So today we use the term major neurocognitive disorder if the memory impairment interferes with life and it persists for 6 months or more, and it involves not only one cognitive function like memory, but it also affects other cognitive functions such as thinking, behavior and language. And we should rule out two conditions, that is, one is depression, the other one is delirium. Delirium is a confusional state that happens to older people mostly whenever they are admitted to hospital for an acute illness, or if infection happens or any other diseases affect them. It is the dementia or major neurocognitive disorder also affects speech when it is called as aphasia. It also affects their functioning, although there is no loss of muscle power, which we call as apraxia, and it is also associated with agnosia. Agnosia is inability to recognize faces and familiar people. Very often the earliest sign is loss of executive function. That means ability to take decision is what is lost early in the disease. So when all these are there, then only we call it as dementia or major neurocognitive disorder. When there is a minor lapses in memory and it is not grossly interfering with life, then we call it as minor neurocognitive disorder. So we should not think that if we have little bit of memory issues, it is already dementia, and you should not think that if you go to a doctor, what will he think, whether you will lose all your rights because you have dementia. So as I said, Alzheimer's disease is a type of dementia or major neurocognitive disorder, which is characterized by what we call as amyloid plaques. They are just big bodies which accumulate in the brain and which almost strangle the nerve connections. And inside the brain cells, which are called as neurons, there is precipitation of a protein called as tau. So these will form what we call as neurofibrillary tangles in the cells of the brain, and that is how both the brain cells and the brain, its connections are lost. We can diagnose this by functional MRI or PET CT, which we rarely do in clinical practice, or by a brain biopsy, or by checking the CSF, that is brain fluid is taken and you look for the tau protein in the brain fluid. So, but we generally don't do this because we are able to diagnose this condition clinically by just doing a MRI and clinical examination. So this is what I told. You can see on the first picture, there are brain cells which are normal. Then the brown bodies that you see in the middle picture is amyloid, and the last picture shows the tangle due to tau protein. So it is very important to address the risk factors: aging, gender and genetics. That means if there is a family history of dementia, those family members are going to get it probably earlier or later. Again, age above 80, 20% can have it; age above 90, 30% can have it, and female gender is more susceptible. So these three we cannot modify, but there are many modifiable risk factors. So all the developed countries have addressed risk factors, so their dementia rate is less compared to the developing countries. So what are the modifiable risk factors? In early life, we have three modifiable risk factors, that is being born with a very low birth weight, that is they are at risk of developing dementia at a later age. If you are not educated, your brain cells don't increase in number or grow in size, so you are at risk. And if you are exposed to psychosocial stress in childhood, then also because of the stress, again brain doesn't reach its normal size, so you are at risk. Again, so if we can focus on children and pregnant women itself and their nutrition, we can really reduce the burden. About 40% of the burden can be reduced by addressing various modifiable risk factors. In midlife, you have 6 risk factors, that is hypertension, so controlling it adequately in midlife or preventing it; dyslipidemia, that is high cholesterol; obesity; physical inactivity; hearing loss and alcohol abuse. So these are 6 modifiable risk factors in midlife. So 40 to 60 or 65, these are the risk factors which can lead to Alzheimer's disease or dementia at a later age. In late life, this is diabetes, depression, poor social connections or engagement, physical inactivity and smoking becomes, these are the risk factors, which is very often we see in older people. They retire from the jobs, they get depressed, either because they have retired or they have lost the spouse or somebody else in the family, and they stop going out, they remain confined to the house. That's where dementia sets in. During COVID times, we have seen it happening in a large number of patients, because elders were not allowed to go out, there was no physical activity for them, and they were socially not engaged. So quite a few, when we have come out and seen them after 2 years, they have lost cognition. So totally there are 16 risk factors which can be modified, and I have just put some of the risk factors I have, like age above 65, female gender and family history, obesity and mild hearing impairment. So my risk score becomes 5, and as I become physically inactive and get depressed or something like that, it's going to really increase. So there are other types of dementia, like Alzheimer's is one type, but what we see more often now is vascular dementia. The small vessel disease of the brain affects neuronal connections in a big way, and that is worsening the dementia. Like people who were normal few months back, in just about 3 to 6 months, they are developing dementia. It is because of probably a COVID related infection which has worsened the thrombosis or clotting of the blood, leading to vascular dementia. So some people call this kind of dementia as Alzheimer's type 3. So Alzheimer's type 1 is genetic, Alzheimer's type 2 is non-genetic Alzheimer's, and Alzheimer's type 3 is Alzheimer's disease with the blood vessel problem added to it. So there are other types like Parkinson's disease with dementia, which has also become very, very common these days, and the other types that are mentioned are less common. But when we say dementia, everybody says it's not treatable, not reversible, but there are many, many diseases which are reversible, although they present with dementia. Simple things like vitamin deficiencies, thyroid disorders, the bleeding outside the brain, which we call as subdural bleeds, normal pressure hydrocephalus, that means brain water just increases. So this can also be completely treated. And post-COVID, we are seeing lots and lots of autoimmune brain disease. That means the body is fighting the brain. The body was fighting COVID and related disorders, but it starts fighting the brain cells itself. And that is again completely treatable and reversible. And we have seen lots of patients who could be reversed when they had this autoimmune disorders. Of course, alcohol, brain injury, and brain infections are to some extent reversible. Simple memory loss and early dementia is very hard to differentiate. However, if you say simple memory loss, the day-to-day functioning is normal and it affects only memory, and after some time if you think, you will be able to remember, okay, I left my spectacles somewhere. But if I really think hard, I'll remember, oh, I had my spectacle last when I took rounds in this particular ward, and I go back and I can find it. Episodes are not forgotten. So because sometimes what happens is we do forget some dates, we do forget something. But if somebody has spoken to us about a function, we may still remember it, but we may forget dates. If I lose some things or misplace things, it will be in appropriate place only, because I know that I keep some important things in 2 or 3 places, and if I search, I'll find them. But suppose I find it in inappropriate place. So my spectacle in a refrigerator or something like that, that's an early sign of dementia. When you have this simple memory issues, friends and relatives won't know about it, but only you will know. But even then, if you think you know that you have memory issue, it's better to come for checkup and go into multi-component intervention. So whereas early dementia, its episodes are forgotten, memory retrieval, you can't take it out, like the whole even if you have forgotten something, it just doesn't come out of the brain, even if you think hard. So why should we test and pick it early? Because is there a cure? That's what all the patients ask. The mild cognitive impairment stage, that we say simple memory issues, it improves with non-pharmacological intervention. That means you don't have to give drugs. It can be reversed with many activities and addressing the risk factors. So if there's no exercise, you give exercise. If you have diabetes, you control it. Hypertension, you control it. If you're not socially connected, you go and connect socially as much as possible. So these are the interventions that really reverse it. Mild dementia can again be arrested or reversed with multi-component intervention, and you may use some drugs. Moderate dementia will partially respond to treatment, and we do use drugs, quite a few of them, and quite a few new drugs have come for treatment of Alzheimer's disease. There is a breakthrough drug which can now remove amyloid from the brain and as well as improve the memory in the brain. So severe dementia, of course, only nursing interventions help, and there may not be any reversibility, but we may improve to the extent that if they are bedridden, we can make them sit. So when I talk about dementia, the patient is going through hell, the caregiver is going through hell. So you must understand that, suppose say your brain cells just keep on erasing the information that is stored. So suppose say 10 years information is lost, the last 10 years. So when I get up, I think I am in an environment where I was 10 years ago. So I will be expecting a room in which I was sleeping, and I will be expecting the scenario 10 years ago. So 10 years ago, where was I? I was working in Kasturba Medical College. So I expect to go to Kasturba Medical College and work. So I may get up and straight away drive and go to Kasturba Medical College and not find my room there, and I may get really upset. So the caregiver should understand that this is what is happening to the person and not think that he is mad or weird or something like that. It can happen, like if you imagine that what were you doing say 5 years ago, 20 years ago, and you think that you are living in that environment, everything makes sense for you and you will understand the person better. So it's very important that we recognize some of the warning signs of dementia and not ignore it. As I told, simple things like mild calculation error, forgetting small events, getting the depression, change in personality, withdrawing socially, or language issues, like suddenly the language changes because somebody was very fluent and was using very high language, suddenly starts making simple language and starts beating around the bush before coming to the point. That itself could be early dementia. So it's very, very important to know this and note that this could be dementia. So simple things like the patient just going to the washroom and forgetting to flush, that could be an early sign of dementia. Or somebody who eats breakfast and forgets that he has had breakfast and asks for breakfast again. So that may be the beginning of dementia. Of course, if you tell, oh, you had your breakfast, immediately the person is going to really improve. The moderate stage can have lots of issues because patient can get up and just go out of the house because again he may think that he is in a different world which is real for him, and he may just go in search of something. So wandering is an issue. They can have little incontinence, that is urinary control may be lost, sleeplessness and repeated questioning, loss of language, hallucinations and delusions, and maybe like they may be dragging the furniture and rearranging to the environment that they are currently living in. In the sense, they may be thinking that my house 15 years had furniture like this and I want to rearrange it like this. So it may be quite irritating for the caregiver. So they may be keeping on searching for lost things because they can't find their things, they think somebody is stealing their things, so they hide it again they go on searching for it. So this will be the most difficult stage of dementia, the moderate one. The last stage is just nursing care, because here patient doesn't speak much and doesn't move much and doesn't recognize much, although I feel they do recognize but they are not able to respond. So here just the care of the bedridden is what is important. So you have to have nursing skills. So how do we diagnose dementia? This clock drawing test is a simple test that we can do. You can see here lots of abnormalities that you can see in the clocks, especially in the bottom 3 clocks and one on the side. This is a simple test called mini clock test, where there is clock drawing as well as we ask them to recall 3 words. MMSE, mini mental status examination, there is an Indian version of it which we use even for illiterate people, and that can at least is a good screening test. So later on, to confirm that the patient has dementia, we use a test called as ACE3, and also we use another test called as clinical dementia rating scale. But when the difference is very mild, we have a very real doubt whether it's mild memory issue of old age or easy going to transform into dementia, there is a test called neuropsychiatric battery which takes about 2 to 3 hours. So as I told, treatment is very, very important at early stages and multi-component interventions. So you can see here in 2002 when my father developed dementia, we started the multi-component intervention center at Kasturba Medical College, and with 8 or 10 of his friends we started an exercise center, and that kept my father going for as long as 4 years. We also started some brain stimulation activities. You can see we also started some centers of yoga to prevent elders from developing dementia and other risk factors. So you can see a group doing yoga, and even we created a trust to encourage physical activity. So we put the elders and middle-aged people together so that they can connect socially, and that social connection which was lost is restarted again. So if you talk about aging brain and dementia, you can see 3 pictures here. The green one is the young brain. So you have new leaves coming in and there's absolutely no gap. This happens only until the age of 5. After 5 you don't have new leaves coming in, but the existing leaves can grow up with education. So still the brain is not empty, but in middle age you can see loss of cells in multiple areas, the middle picture. The last picture shows lot of cells are lost, very few cells are left, the red one. So if we pick it up in the middle stage, you can see that there are cells in multiple places and they can still function if we give stimulation. And by chance, if some cells are lost in one area, the other side cells can take over the function. That is called as neuroplasticity. Neuroplasticity is what we will achieve by multi-component intervention. So, not all elderly will develop dementia. You can see my mother, 95-year-old, who passed away at the age of 95, but her memory was intact because she was always connected socially. She was always busy doing lots of activities. So my message to elders is be active, be connected, and exercise regularly. Do whatever you can, yoga, exercise, dance, music, art, learn a new language, learn something new, teach others, do some social service, then you can really push dementia away. It is never too early and never too late. Thank you very much for your patient listening.